So I thought this was an interesting video that Dr. Yoon posted yesterday, and the comments cracked me up because there are so many people that are advocating for insurance fraud. So I thought I would explain a little bit about what actually happens in this situation and how we handle this as plastic surgeons. So for those of you that don't know me, I'm Dr. Killeen. I'm a board certified plastic surgeon. I do primarily breast and I do a lot of breast reduction. So here's how this scenario usually plays out. So insurance companies require that you remove a certain amount of tissue, and that is based off of something called the Schnur scale. And I have some videos in my breast reduction playlist that explain this a little bit better. So that's the amount of tissue that we are required to remove from each side in order to get your surgery covered. But that doesn't mean we have to do it. It's just that's how much has to be removed if insurance is going to kick in. Now, the Schnur scale is not based off of BMI. I saw people saying that in the comments. It's actually based off of your body's surface area, and it's from a study that was done many years ago that was never intended to be used for this particular purpose. Plastic surgeons are against it. The doctor that did the study is against it, but unfortunately, it just is what it is. So a few things about this video. So for those of us that do a lot of breast reductions, we're really good at figuring out how much tissue we're probably going to be able to remove from you. And we always discuss this with patients beforehand. So our goal in the OR is not to meet what the insurance wants. We always are meeting what you want. And the consent forms and the forms you fill out at the surgery center are very clear. Our goal is meeting your goals. It's not meeting insurance requirements. So if I'm doing a surgery on a patient who wants to be a certain size or proportion, and that is way out of line with what the insurance wants, I don't just do what the insurance wants, I do what you want. But then you need to understand that insurance may not cover your surgery. So every single patient who receives care in the hospital, has surgery, etc., fills out all kinds of forms when you're admitted. And it's really important you look at those forms, because always in that packet is a form that will state if your insurance does not cover your care, that you are financially responsible for that care. And that's indeed what can happen with breast reductions. But like I said, ethical plastic surgeons will always inform patients that this is a potential, especially when the patient is very close and potentially won't meet Schnur. So as a plastic surgeon, my relationship is with you as the patient, and I'm there to do what you want. And my job is to educate you about whether or not your insurance will cover that. My job is not to do what the insurance company wants. I don't work for them. I work for you, so to speak. So for the people that were saying that we would make decisions based off of what they want, that's not how this works. We would never do that. There was also some people saying funny things like that waking the patient up is the right thing to do. No, that is not the right thing to do. So if you've ever seen a breast reduction, we have very large incisions and a large open wound. It can take hours to close. We are not going to close you, wake you up, and wait for 8 hours for anesthesia to wear out, ask you a question, and then take you back to the operating room with you swollen. And it just doesn't make any sense. Nobody would ever do that. That's not a reasonable option. I think it's kind of funny to even suggest that. So again, it's a fun exercise, but in reality, this just would not likely happen. Now, when it comes to insurance fraud, we all hate insurance companies. I'm right there with you. I hate them. You have no idea how much I hate them. I hate working with them. They don't cover things they should cover. I would love to burn them all to the ground, but I'm not going to lose my license, go to jail, or get in trouble because I'm fighting with them. I think the way to fight with insurance companies is to disempower them. And so I would encourage you all to use your vote to vote against the interests of insurance companies. And it's pretty easy to find out what political candidates are funded by these insurance companies. And I think that we need to get insurance companies out of lobbying to make decisions for your health care. I think you and your doctor should make that decision. And that's really the best way. I don't want to go to jail. I don't want you to go to jail. I don't want any of us to get in trouble. And if you find a doctor that's willing to lie for you in this way, I mean, you'd have to get the doctor, the pathologist, the nurse, and everyone. I always tell patients how you do one thing is how you do all things. People are never unethical in one area. They're unethical in all areas. And if a doctor is going to lie for you, they could easily lie to you. And so you want an ethical, honest practitioner who will take amazing care of you, educate you, and warn you before surgery what the possibilities are, and make sure that you as a patient are okay with that. So we hate the Schnur scale too. We hate insurers too. But I think we all need to operate in an ethical, honest way. And then let's use our collective power to get these assholes out of our healthcare, because they certainly make things harder for both doctors and patients.